Daktari, a quick one. Again, we are back in the city, in the sun. Kisumu itself, the lake city, lakeside. Na leo nawaletea one of my very good friends. Jamaa tumetoka naye mbali, tumetoka naye afar. Yeah, kule back in Siriba, Maseno. Yeah? Ndo tulimeet with Dr. Japheth Siome. And he turned out to be one of the most amazing people I've interacted with. And he's doing a lot of things. Tulikuwa namuita Janango. Alikuwa mshamba, lakini siku hizi amechanuka kidogo. So we are going to be having an amazing discussion with Siome. We're going to be talking about politics, we're talking about health and all that. And we're going to bring you a very amazing show. So stay tuned. And kama like, comment, share, tell us what you think. Na tujue inakuwa kwaje. Otherwise, furahia the episode. If you have any questions, let me know. Karibuni tena to yet another episode of Daktari, a quick one. As I promised from the last episode with Dr. Neema, Kisumu is the place to be. And there is no better second guest in Kisumu than future governor of Kisumu. Boy here looking like a corrupt politician. Tumbo mbele, shati ya Uhuru. Today we have the one and only Dr. Japheth. Is it Japheth or Japheth Siome? Usikia venye anacheka kama like a politician was about to lie about SHIF and SHIF. Siome.
Yes, Doc.
Karibu, bro.
Thank you.
Welcome very much to Daktari, a quick one. Siome, for those who might not know, was my classmate. But more on that later. Karibu, Siome.
Asante sana daktari.
Have you been watching this nini? Ama we ni wale unajua wanasemanga my friends do not support me. Unajua nunui nyanya zako, unapita nyanya ya best yako unaenda kununua ya jirani. Have you been watching
I take time out of my busy schedule to watch my episodes.
Luos in the house on Mera. Leo mtajua mtu.
Yeah, but I do watch.
You do watch.
You take some times to watch.
Now,
this is a good one actually.
Yeah. We've been planning for you to be a guest for quite some time. Sasa nimeleta the studio to you ndio usinipe excuses, and thank God you're here. Karibu sana.
Thank you.
So I hope it's going to be an amazing episode. We hope to tap from your knowledge and wisdom.
You hope to drink from my chalice of wisdom.
Chalice. Ushaanza. Hey. Yawa. Leo sijui nitaenda. Sasa chalice ni nini?
Chalice. You're a Catholic or Anglican? Or those funny churches in Western?
What are the funny churches in Western? I am a PhD.
You take the sacrament in a church.
The last time I was in church,
so
we took
that
sacrament.
cup used to drink wine. It's called a chalice.
It's called a chalice.
A chalice.
Okay. Now I've learned something new. I'm supposed to start going back to church. Nimesahau Bible kidogo. Unajua tulikuwa tumemaliza syllabus. So I stopped. Now, kama sijui chalice, itabidi nirudi.
You have to. But I think chalice is not about going to church. It's English. That's not English.
It's just English.
Not English.
Thank you for teaching us. So Siome, karibu sana.
Thank you, Festus.
How do you like to be introduced before ni Siome? Say, introduce. I give my guests the pleasure of introducing themselves. So tuambie how you like to be known.
Japheth Siome Okewa. That is me.
Full stop.
The others are prefixes. But I'm Japheth Siome Okewa. Yes.
What do you do, Mr. Japheth? You're a doctor.
I'm a medical doctor.
Working where?
Currently working at Usigu County Hospital as the med sup.
Usigu.
Usigu.
Maybe Usigu. Usigu, I'm hearing from you. Usigu is in Siaya, should be?
Yes, in Siaya County.
Because last time I checked, you were in Siaya.
It's actually a sub-county.
Sub-county hospital.
It's a sub-county, yes.
Sub-county hospitals, that's level what?
That's level 4.
Level 4?
Yeah. Something you should actually know.
Yeah, it's something I should know. And I realized I was doing an episode with some clinical officer, and I realized kumbe mimi sijui hizi levels. Yeah, but then they say it's level 4, but you find that most of the time it's just level 4 on paper, right? Would you think that's a correct observation? Because
yes,
I know where I work is apparently a level 5, but it's just level 5 on paper. Realistically, things are very different.
Because you want to.
What do you mean? Do I want to?
Because you want to.
I want to
Is
do what?
level 5 on paper
Uh-huh.
and not on the ground because you want to. As someone who works there,
You think the problem is the people who work there?
including you.
Okay. You think
Beginning
I
with
am
you.
the one who's making it not to be
You
at
are
the
part
level?
of the consortium that makes it. Because if you are working in a place that is a level 5 on paper and not a level 5 on the ground, and you are comfortable, then you are part of the problem. Like as the medical Usigu level 4 hospital, there are things that I'll want to be there. And I'll be assertive that they must be
They
there.
must be there.
Of
As
course
the
not
med soup.
as the med soup. Yes.
But what do you think one of your nurses in maternity has the ability to decide?
Of course, but guided decisions.
Well, I know, there's that we should all come together and discuss where, if there's what is called the HMT, in the hospitals. Yeah, but I think the power to actually decide does not rest on the workers, does it?
On the workers. No, it doesn't. It doesn't. But then they are part of the decision making process.
Yeah.
Yes.
From the ground.
From the ground. Actually, an HMT is made of head of departments.
Head of departments.
Yeah.
True.
So they should come up with deliberations from their members.
I think let's talk about Usigu.
Yes.
Let's just go to the ground and talk about Usigu now that you brought up Usigu, where you are the head of Usigu. Okay?
Yes.
Leo tunakutoanisha hapa. Yeah, we have to find out why Usigu is a level 4. Is it level 4 both on paper and on ground? Would you say that?
Has just been promoted to a level 4.
Just
a few months ago. Just a few months ago. With me as the first med soup. But I can assure you that by the end of this year, it will be a level 4, both on paper and on the ground.
So what constitutes a level 4 on paper?
On paper. Actually, there's a checklist. There's a checklist. A lot of things. Yeah, both infrastructure, human resource. Like level 4 should.
Is there like a bed capacity?
There's a bed capacity. There's the number of consultants that it needs to have. The number of services that should be there, and infrastructure that should be in a level 4. These are a checklist by KMPDC that we can't go through all of it.
It's a lot of things.
A long list.
So yes. Does Usigu meet 80%, 40%, 10%?
I'll say 50%.
50.
Yes. Currently, it was a health center that has just been made a level 4 a few months ago. Actually, a month or 2 months ago. So it is us to make it a level 4.
Okay.
And we will. Because I believe that as a leader, it cannot be done. It should not be the language of a leader. That is Megona 2017.
Your quote, pull up and start again.
It cannot be done. It should not be the language of a leader. Megona 2017.
Is that the language of a leader or language of a politician?
A leader.
Because a real leader should be realistic.
Yes. And a leader should not say that it cannot be done. Why can't it be done?
But what if it can't?
Yes.
What if it can't? I mean, there are some things that might be beyond the scope of the leader.
Why?
Because I've been on this podcast, I hosted Dr. Milimu.
Dr. Milimu?
Yeah, he was also a med soup of a sub-county hospital. I understand he's no longer in that position. And what came out, because we were discussing these issues of, how to go about improving the facility, and because he's very visionary, and I get that from young doctors, especially those who are put in leadership positions, very visionary, but you get to the ground and things are not the same, because are not what you expect. I mean, because there is bureaucracy when it comes to maybe procurement, and there is because even that's Dr. Milimu was in Western Kenya. You were in Siaya. Yes, I talked to Dr. Florence. Dr. Florence resigned from a very lucrative position in the health management system in Nairobi County.
Oh,
yeah, because she was citing political interference and lack of political goodwill when it comes to actually bringing services to the people, because she was also a med sup in a sub-county hospital. So do you anticipate those challenges? How long have you been a med sup?
A month.
It's more than a month.
It's a month, actually.
A month.
Yeah, it is a month.
Are you anticipating any challenges?
I do. But Festo, you've mentioned political interference. Festo, politics and religion runs the world.
True.
So we can't isolate ourselves from politics.
We cannot.
As a leader, if you say that now I've resigned because of political interference, well, first you must be a politician.
To be a leader.
And you must engulf with the politicians. Because truth be said, there are a lot of things that involves policy. Yeah. And it is the MCAs, it is the MPs that make these policies. So you must be in politics.
You must.
As a leader. You must be in religion as a leader. As a doctor, actually, the doctor is like a God's co-creator. So you must be all round. So when you say that I want to isolate myself, I just want to be a med sup, I don't want political interference, you must involve yourself in those, all those, yeah.
But there is political interference. Political interference can be positive and negative.
Yes.
So what I am specifically talking about is negative political interference.
You be in that politics.
Yeah,
so you negate.
you be the positive change you want to see.
Yes, but you be in that politics.
You see, you've just come in as a leader in a med sup position. So probably this is your first time engaging in the core management and politics and leadership of that county.
Yes.
There are people who've been there and there are people who have vested interests. We know that. You know that, right? There are people, like you say, there's MCAs and all.
Yes.
There are people who want a bite of that cake from your hospital. Yeah? How are you going to maneuver them? Because these are people who probably, the MCAs, they're not medics. How are you going to tell them that it is important for me to have this amount of insulin? Just imekaa tu, inangoja emergency.
Make that cake bitter so that they bite it, they find it bitter. So they don't want to bite it. What I mean is this. Huh?
What do you mean?
Festus. Are you Festus or Festo? You know, your name.
A man can have many names.
Well, you're Festo.
I am both.
I find it a funny name, Festo. Now, as a leader, every person, you know why you're a leader first?
Me?
You know why somebody is made a leader? Or one of the functions of a leader is to try find a way where there's no way. Is to try navigate things. And that's why not all of us are leaders. So when you're made a leader, you try to find a compromise. Sometimes you try to find a compromise in situations. When you explain to a politician, you go to him, sit him down and explain to him, these are human beings. And everyone has an underbelly. Everyone has a soft side. So if you explain to them well that there's need for this and you give them scenarios, you'll find a way, Fester. Yes, that's what I believe.
So you've said not all of us can be leaders.
Not all.
But as you know, so what makes you as Siome? What makes you stand out and what makes you believe? Because I've just given you two good examples of doctors who've been in that position, very similar to yours, and both of them didn't last more than 3 years. I think Milimu has lasted for some time, almost 3 years. But okay, Dr. Florence did well as a med sup, but then when she was promoted to a higher level, she was like, apana. But then even when you watch the podcast, she says that at some point as a med sup, she had to buy medication for patients and things like that. What makes you think that you can weather those challenges? Because they're going to come.
Yeah, sure.
And may I ask, are you the only doctor in this sub-county?
Sure.
For now, you're the only doctor.
Sure.
So you're going to have patients, for example, who you can see. This patient, for example, needs this drug and it's not in the hospital. It is not there. And you call whoever you can call and you're given hekayas and stories. How are you going to handle that? Because it's going to come.
There are ways to go about that. There are ways to go about that. You can buy the drug on your own and get a receipt, and later on
can get reimbursed.
Yeah. There are ways around it. You don't have to think so much about some issues.
But how long can you do that?
Not very long.
That is actually what I'm saying. It's okay, you can do that, but is it sustainable?
It's not. I think the first thing you need to do as a leader is you must have a lot of wisdom. That's number one. A lot of it is needed as a leader. Number two, don't lead alone. It must not be a one-man show.
Have people around you.
Yeah, you are the med soup, you want to do this, you want to do this, you want to do this. Yeah. Have a team and actually involve them. Involve them in every single process. So that if someone fails in the pharmacy, it can be held responsible that we give you someone to buy drugs
And
for the pharmacy and you did not. But if you're the med soup and you want to buy drugs
on your own,
you want to be the one procuring salt in the kitchen, that now becomes a problem.
Should embrace some teamwork.
So you embrace teamwork and involve these people. You see, as a leader, the most important resource I have is the human resource in that hospital. Before I ask for X-ray, before I ask for ultrasound machine, before I ask for that,
your people,
these people that I have are the most important resource I have.
Yeah, especially in a hospital setting.
Yes.
Yeah.
So once you make them, you see, the Bible says, I forgot a lot of chapters, that where your heart is where you are, something like that. Yeah, you can help me. You know, you're a Christian too, bro.
Yes. The Bible naijua cover to cover. What's the forgetting ungesema chapter ningekutolea verse brother.
But where your wealth is where your heart is.
What?
Where your wealth is where your heart is.
Your heart is.
Yeah. So when you make someone feel involved, they become stewards. Yeah, they become stewards. And they want to see it work.
Because they feel part of the process.
They feel part of the process.
They feel like it's part of
But
them.
now when you're a med soup and people are just seeing buildings being painted, buildings coming up, drugs have been procured, and they don't know where they're coming from. They'll sabotage you. Yeah, they'll sabotage you. And first drugs are not expensive. Let me tell you that.
So
you know.
So I hear.
So you?
Nasikianga hivyo.
You don't know?
I really don't know. I'm not in the business.
So you treat patients with
no, but you see what I know about medication in our country, that there's different types of there's different medication for different people. I mean there is like take for example of metformin, the molecule metformin. How many types of metformin are there?
So many types.
There are so many. But you'll find one metformin that goes for 50 bob a tablet and one that goes for 5 bob a tablet.
5 bob a tablet, yes.
Yeah. So when you say medication is cheap, I'll ask you which medication.
But some of they work.
Yeah.
Some of they all work.
They all work. They all work.
So medications are cheap.
But medications that are given to the public, medications that are in the public hospitals are cheap.
And they're affordable.
They're
affordable.
And they work.
Then why are there no medications in the hospitals?
That's the question.
One is just like having anemia. It could be there's no intake. Or there is excessive loss. Or breakdown of red blood cells.
Yeah.
So it could be these drugs are getting out of the hospital. That's number one, pilferage.
Or they could be they're not coming.
Or they're not coming. But now once they come,
in your experience, which one of those two answers do you lean
people
more
steal
towards?
drugs. People steal drugs, Festus. People steal drugs. And that's the first thing you need to act on. You must seal all the loopholes.
But how do people steal drugs?
How do
people steal drugs? Because in the county hospital where I've worked, you cannot get your pharmacist haendi kukupatia dawa without a prescription. In fact, there's a system. If when you send a patient and the drug is not reflecting in the system, they are not going to give you. They'll send them back to the doctor. Go tell them to put it in the system.
It's not the patient's social drugs, Daktari.
No, I'm just saying, for example, that's an example. If a patient, even with a written prescription, won't get it, how are people stealing it?
They know how they steal. Me, I've never stolen a drug. They're the ones who know this. But they steal drugs are coming from hospitals.
That's one.
So we need to put bottlenecks and checkpoints everywhere to ensure that those loopholes are closed.
Me, I think it's more of drugs are not there. Drugs don't come.
That's also a point. That's also a point. That's why I told drugs are cheap. So we can buy them. Drugs,
So yeah, the problem is not the cost.
yes, the cost, drugs can be procured.
And actually the KEMSA one is actually very subsidized in you.
Very subsidized. So we can buy the drugs. And they're not very expensive. And they're sustainable. But a lot of drugs siphon out of facilities. I think that's the first thing. I sat down with my team and told them, one thing I will not condone is drugs getting out of the facility that are meant to for the patients.
But not just drugs, you know, equipment also gets lost.
Yeah.
For equipment now, I agree, because equipment to potea.
When I was in a facility in Western Kenya, I will not mention the name.
We won't name names.
I'll not mention names, yeah? But you know where I was in Western Kenya.
For me, I know.
Yes. Somebody picked a monitor from theater.
A whole monitor.
You heard about it?
I don't know.
You didn't hear about it?
Story ni yako. Sasa mimi najua aje.
You also worked there. So. Someone came and picked a monitor despite all the CCTVs around. Came to that theater where that theater is located. The theater is underground. It is. Someone came and picked a monitor and walked away with it, and it was never found.
And nobody knew who did it.
And nobody knew who did it.
And there's security camera, there's security personnel.
Watchmen everywhere.
And it's a monitor. A monitor is huge.
A monitor is huge. It's actually bigger than you.
Is it bigger than your stomach?
But someone managed to pick it and walk with it out of that theater. So a lot of that is going on.
Yeah.
If we can find a way of ensuring that the ones we have procured do not get lost.
But I feel for something like that, it's about just the hospital management. I mean, the hospital should have good security systems.
Yeah, sure.
I mean, there should be alarms. In Kenya, we have cops. Not cops, I mean the guards, security guards. And they all have this screening thing. And even the one where you're getting into a mall, you pass through it always, mi ushanga. At what point are they supposed to stop you and tell you, wewe hii imelia, hebu rudi tukuangalia, because you will go, it will beep, and they just tell you to go.
That's the paradox.
They'll screen you, it beeps, and you're like, okay, what was the point?
I think as a nation, we're doing things for the sake of it.
Yeah.
For the sake of it.
Yeah, so the security guys in the hospital are just there
for the sake of it.
That they're there.
And that has even crawled into our healthcare system. We're doing things for the sake of it. Even medical training right now is for the sake of it. Doc, you know that?
Kupita through the system.
Or you don't know?
Tell me about it.
Is for the sake of it. A doctor or a contemporary doctor and a doctor of the 1970s, 1980s, you can't compare. It's a far cry from those guys. Yeah. Things have been diluted so much in the nation.
But you know, people argue that, even I saw somebody on social media claiming that they should reduce the number of years taken in medical schools from 6 to 4, because nowadays information is available on social media, on the internet. There's all that. So they're like, why are we taking so long?
Is the person a doctor?
Actually, that person is a doctor.
A contemporary doctor.
What do you mean by contemporary? Unajua mimi kizungu inanipitanga.
Contemporary is the current doctor.
Oh, yeah. He's one of our age group.
Our age group. So he's saying it should be
reduced to 4 years. To 4 years. The 6 years.
It should be increased, actually.
Yeah.
It should be very tighter. Yeah.
Speaking of med school, of medical education, you and I had the preview of going to the same medical school.
Yeah, sure. One of the best in the country.
One?
Oh, the best.
Jesus Christ. Yeah. We had that privilege. So when we were going there, we were like, hey, this is personally, I was like, am I sure? Yeah, and people were like, hey, Maseno, it's a young medical school, are you sure? And all. But it turned out to be what it was meant to be. How was med school for you? First of all, tuambie, how did you get yourself to med school?
It was I think the best experience I've ever had in my life. Okay, I can't say, but in my current life, because maybe I have better experiences later on.
In other lives?
No, maybe this life.
Oh, so far.
Yeah,
So
so
it's your
far.
best experience so
Yeah,
far.
at this instant. Yeah, Maseno was good.
You know, I told Dr. Florence
Hmm.
about that medical school was fun for us. We enjoyed it and all. And she was shocked.
She was shocked.
Yeah, because she was in a medical school where she didn't even know her classmates, you know.
Oh, there were many.
There were many, and she felt alone and all that. I was like, hey, kwetu manze hiyo haikukua. So you also, kumbe sio mi peke yangu.
You also enjoyed it.
I loved it. So how you loved it? What did you love about
Because
medical
I
school?
think Maseno embraced an holistic approach to medical training. Yeah, Maseno embraced a holistic approach. Remember, Festus, we were in med school, but we managed to even be in politics. You remember that?
We did.
We were in politics. We were in Christian Union.
We were.
Though you never used to go to church.
I went for first year na second year kidogo. Nikamaliza syllabus.
And even our training was, I can say, a holistic approach.
Yeah.
Where we were taught to treat the patient,
Yeah.
not the illness. The patient. I think that's what brings us out.
Yeah.
Another thing that we were taught that maybe you've forgotten is to be a wholesome doctor. First, as you go to theater and the theater is not clean, as the surgeon, do you just go there and do the operation and then you walk out? Or do you speak out?
You do.
You speak out.
Yeah.
Maseno taught us to speak out. I think that is one thing that I appreciate about Maseno. It taught us to speak out. It taught us that we cannot isolate our practice from other things happening in the hospital.
Yeah.
You walk into a ward round and a patient is actually being treated for constipation na amewekewa ugali ya wimbi hapo kubwa na mboga na sukuma wiki. And you just walk. You must not taught us to be aware of our environment, to be assertive, and to speak out of things. And I think that has really helped me. That has shaped me a lot.
It has.
As a doctor.
Yeah, I think even when we got to internship, there was a very big difference. You could feel that there is a gap between you and your other interns, because you
like heaven and earth.
You have to. Well, heaven and earth might. Okay. To be politically correct, it's like at night, like usiku, and later that night. It's not a very big difference. But yeah, there is that difference. Though sometimes there are people who do catch up from other universities, but sometimes you do when it's too late, because you know the basics are very important. And I've actually raised this issue with the issue of training with a couple of my guests, and they always point towards numbers. Yeah, because usually the comparison is the mother.
Remember, I was in University of Nairobi in first year.
Oh, you are?
And
tell us about that story.
I left after 3 months. You know why?
Tell us about that.
You know why I left?
First of all, no. Pull up. Before you tell us why you left, tell us, did you always want to become a doctor? You as Siome?
Always.
So when and how, as growing up, or why did you decide that you... What influenced your decision to want to become a doctor?
So, where I was in high school, bright chaps did medicine. No, I'm telling you what happened. What did we tell you?
I'm listening. So,
where I was in high school, in Maranda High School.
Oh, you were in Maranda.
The top students, number one,
Maranda,
would always do medicine. Then maybe number two would do engineering. Number three would do law. And that was how things were. Because after KCSE, they will print the courses people have taken. Which I think should change. But I'll come to that. So, as a top student, that is what influenced my doing medicine. And again, in 2012, something happened. I lost a brother.
Oh.
In my arms, we were actually running to the hospital. So that further influenced my choice.
In 2012.
In 2012.
This is after your...
That's 23 years after high school.
After high school.
Yeah.
Your brother died?
My brother passed in my arms. Actually, I was carrying him to the hospital. So when the guys came and said, this is like he has died. And I was still carrying him. Yeah, so that also influenced that. Let me go and
At that time, you didn't know.
Yes.
You didn't know how to check for pulses.
I didn't know. I thought I was just carrying him.
Mm.
But I wish he didn't die because that should not actually, it's something that should not have influenced my choice for a career. I feel someone from my school is not mature enough to choose a career. I is not. Or there should be some exposure, maybe in high school, in these careers, there should be some exposure.
Is that, I don't know, is that what CBC is trying to achieve by, I'm not a parent,
CBC.
so I don't know much about
CBC.
CBC.
CBC is bullshit. That's what I'll call it. That's bullshit. That's bullshit.
But
it's not well thought.
It's not well thought.
Yeah, it's not well thought.
But they're trying to say that they're trying to expose these children to the things they like earlier. Because, that story you're saying of, top student taking medicine.
Yes.
It's why most of us ended up in medical
even
school.
You are a top student. You're a top student.
I might not look like it right now,
but you are.
But I was.
I pity that school.
Yeah, because and for me it was I even thought about it while I was somewhere in Form 2. Like somebody asked, well, unaweza fanya medicine, just friends talking, and I was like, mimi nikipata A nitafanya medicine.
Yeah, that was it.
Yeah.
A medicine.
Yeah, nikipata A nitafanya medicine. But looking backward, I had never even met a doctor at that point.
Same here.
Yeah.
I didn't even have a reason why I want to be a doctor.
Yeah. Apart from getting the A.
Apart from being the top student.
Yeah.
And top students doing medicine.
Yeah. That's a culture that you need to
It's a culture we should actually not have. I think top students should actually do computer science, to do the cyber crime, and even become teachers.
So why do you think it has been like that for a long time, that the top students go into medicine?
There could be reasons. One,
is medicine hard?
Medicine is bulky. That I'll tell you.
It is
very bulky. And it requires a brain that has very good potassium channels that open very fast, very efficiently.
Which are the A's,
Which are the A's, yes. But even a C+ has some good potassium channels. Yeah.
But the pump might be a bit slow.
The pump may be slow.
The channel might be okay. But the 80 pace pump hapo inakata kidogo.
Yeah, but I believe anyone who can go to a university
can pursue
do medicine.
Because I know right now Aga Khan is taking C+.
Yeah, anyone who can go to a university, who can make it to a university with his brain, not assisted. There are assisted pumps. There are pumps.
How do you assist?
There are assisted A's. Those are assisted. Exams are stolen out there. Yeah, people steal exams for students. So any student who can manage a C+
on their
own can do medicine comfortably. Of course, with some difficulties. The training is hard. The training is hard. But the practice requires good attitude, a good mindset, and an average brain. Of course, first as we know, a below average brain cannot do medicine. Cannot. Because
it's too much to take.
Yeah, it's bulky. It's like, according to Professor Joy, Professor Joy?
Yeah, I know.
A good professor. Yeah, he was telling first years sometimes back when I was your president. You remember I was the president of the medical school?
Yeah.
Did you vote for me?
I campaigned for you, man.
I also campaigned for you and you lost to Bonnie.
We are coming to that. We're coming to
that, yeah?
Nostalgia.
Professor Joey was telling the students that medicine is like being given water. Water. You can take water with a straw. That's easy. But in this case, I know you had to. You've been a funny chap since campus.
Talents.
You have some funny
kama
jokes.
Sikupata A's ningekuwa comedian.
You could have made a good one.
Mimi na Churchill. Angekuwa naeka Churchill show.
You look like Eric Omondi.
Nyadimu show.
You look like Eric Omondi.
I don't look like
Eric. But now a smaller version of Eric Omondi.
Eric used to be small. Sasa mimi acha pesa tasi taingia mtaona nimekuwa na misuli.
So Prof Joy was saying
water is like a straw. You can take with a straw.
You can take with a straw. It's easy. But now in medicine, a hose pipe. So someone takes a hose pipe and put in your mouth and then pumps water with it. and they want you to drink it without choking. So that's what medicine is. A lot of information. Like in first year, there was a lot of information coming in: anatomy, physiology, biochemistry.
Yeah.
Until you wonder now, which subject is this? Yeah. You wonder, you start asking yourself, when are we going to start learning medicine? You didn't ask that?
Yeah, we used to ask yourself, sasa mgonjwa atakuja akiwa ananiambia calmodulin
up to third year. You are still being pumped with basic sciences. So that's what medicine is, and you have to grasp them. I think that is important.
Yeah.
That is important. But a C student, a C+ student who is organized is able to grasp, though with difficulties. And A students grasp them very easily and very fast. But that's not the only factor required in medicine. There are other factors that this C+ student may have that A student may not have. But something like computer science, you require those good channels
throughout.
You may not need compassion and
because you're not dealing with humans.
In cybercrime, you may not need those. In engineering, I think so. Let not engineers sue me. Engineers sue me. But I think those sharp students should do something like engineering, architecture.
So in medicine, they should be average
and above average. From average to above average. It should not be limited to A students.
Mi ningefanya nini?
Well, but ungefanya nini?
One wonders. You know, looking back, I always had passion for, like, looking back. Because even looking back, way back, even when I was in, lower primary, I was in drama. Somehow I just took myself to drama.
Okay.
Like, there were several clubs, but I took myself to drama. I was in the debate club later on. I was even president of the debate club. Later on, in campus, I was in journalism club. Even now in that's a high school. Campus, I was doing all these media things, emceeing and stuff like that.
Yeah.
So looking all back, I'm like, wow, maybe I should have gone the journalism way. If maybe I had the mentorship, maybe I should have gone into maybe movies and things like that.
Yeah, sure.
Do you have something like that yourself?
Before I go there, I think that what you could have done best. Can I tell you?
This looks like a diss coming.
No. No. But you could have made a very good ECD teacher. Nursery school teacher. You could have made a very good one. No, it's true.
Yeah.
You
could have made a very good grave digger. In the village. Ungekuwa wale the lead grave digger. Wale kuku ya watu ya kaburi bwana hatujapewa.
That was a fair enough joke. Not a good, but a fair enough.
My jokes are always top notch. Sai watu wana roll. Audience. Wako kwa floor. So did you have any other passions? Okay, aside from knowing, maybe you knew from Form 1 that you're a top student? From Form 1. Ulijua, many top students wanafanyanga A.
When I was in primary, I thought I was supposed to be number 1. That's what I thought. Because from class 1 to class 8, we're always number 1. So I only realized that Okewa and number 1 are not to Form 1 in Maranda. When I became position 5. From 1 to 1, I was position 5. And I realized that, kumbe siamas nikuwe number 1. So,
ukajua kumbe number 1 si ati ni yako tu.
Yeah.
You thought it was genetic.
Yeah, but I loved my teacher of chemistry in Form 1. And I loved chemistry so much. So much that I thought I could be a teacher of chemistry.
Teacher of chemistry.
Right now here, where we are, I'm the only one who can draw aluminum chloride. I know you can't draw that.
I can draw aluminum chloride.
You can't.
I'll
get a piece of paper and you can't.
Aluminum chloride?
You can't.
Nachora basi.
Al?
CL3.
You have messed it up already. Aluminum chloride exists as a dimer. So once you say AlCl3, then you have messed it already.
So you were very good in chemistry.
In chemistry. I loved chemistry so much. Yeah, and I think I would have done better as a teacher of chemistry than as a doctor. Yeah.
Wow.
Yeah.
Wow. I have never met somebody who wanted to become a teacher from the word go.
I thought I would have done it as a teacher of chemistry. I think so.
And you love teaching?
Yeah, I love teaching. I teach a lot.
But you know what they say
Uh-huh.
about medicine is that it's a very wide career. You can still teach.
Yeah.
And you can teach something better than chemistry. You can teach physiology. You can teach biochemistry.
Yeah, sure. You always have a point. But then, first, if you become a doctor, just be a doctor.
No, but medical students need training.
Uh-huh.
And as you've said, maybe currently the training is probably falling below par.
Yeah, that's true. It's falling below par first. You can't compare us, the likes of Professor Joey, the likes of... Were you in around with Professor Joey Festus?
I was.
With Professor Joey in a ward round.
Brilliance.
Eh?
I was there.
How you will dissect a patient who has just come with constipation.
Oh, my friend.
And a doc would go until it reaches the nerves and gets into the cerebellum, gets out through the cerebrum, comes back to the pons,
comes back to the colon.
and then finds the cause of this constipation. Professor Joey.
It was amazing. I mean, the likes of Joey or Joe and
were you taught by
there was
Professor
HP
Owuor?
Yeah. I mean, those guys were
Professor
brilliant.
Juan. You can't compare their training with
Yeah,
ours.
Those guys made me really love the like you love seeing sick patients just for the fact that you come up with a diagnosis.
With the diagnosis.
And it's so interesting.
Very interesting.
Somebody was complaining of a foot something and...
You see, there's a time when I went around with Dr. Ojo.
Ojo.
And a patient
we need to have Ojo on this podcast.
A patient was coughing. Just a cough. That is not... You're not clearing with all the kind of drugs being given. And then Prof orders for a urinalysis.
Was that dextrose or what?
Yes.
What did the patient have? I think I remember this.
You remember it?
Was it good pasta or dextrose?
You were there. You remember
there,
it.
right? Yeah.
Prof orders a urinalysis.
Yeah.
And then comes the diagnosis and we were like...
Yeah.
With our mouths agape.
Yeah.
So such kind of doctors
are no longer there.
They're there. Ojo is still alive.
Then you said contemporary doctors.
Us now.
We are not at that.
I think there's a deficit.
There is, and
there's a deficit.
Most of us are. The culture shock I got when I started working is the level at which other doctors consulted. This is in Nairobi. As we were trained in JTRH, where probably you consult as the last thing.
Yes.
The level at which people consulted, I was shocked. I mean, okay, it is good to consult.
Yes.
It is very good to consult.
Very healthy.
Very healthy. But I was like, come on. This is malaria. I mean, because to me, the way I had been taught was like, you make a diagnosis, come up with a plan, start treatment. But these people had this training of, clerk, have your probably impression and call.
Then you consult.
Call the consultant.
Oh.
At that point, call the consultant, no plan. And I think it's still happening even in some the major private hospitals. That is how it goes. Even at resident level. You have to involve your consultant.
When are you joining residency?
Every step.
We'll come to that, I know.
You were telling, before you go that, you were telling me now how you, an A student now, you said now you joined med school?
Yes, I joined med school.
In UN?
In UN, yes.
This is the year 20?
That is 2013 was it 20th June? Yes.
And then?
But first as we were 600 in a class. 600.
And you were number 559.
600 first as. How do you learn?
Yeah. But I hear the halls are very big and there are several consultants.
That makes it even worse. The halls are big, so when you sit behind there and the lecturer is up there with a microphone.
They teach you with a microphone.
Yeah, so how do you learn first?
So is that the reason you left?
That was the reason. I had to change. And Maseno was just starting. I think it was the second year or third year. So I had to come to Maseno.
How did you choose Maseno? There was KU. There was, Hackathon. There was Moi.
Yeah, I could, because there were choices that I could go to. So Maseno was one of them. So I came to Maseno.
In MCQ, only guess to. Or you were going somewhere near home?
No, not Nyago. One of my moms was working at Maseno in the library, so it was easier coming to Maseno.
What do you mean one was your moms? How many moms do you have?
3.
You have 3 moms?
Yeah, my father is polygamous.
Tell us about that. Where were you born, by the way?
Where?
Ulizaliwa wapi?
Sinai Hospital.
Sinai Hospital is...
It was in Bondo. With that time, it was the best in Bondo.
Yeah. You're from Bondo.
Yeah, and mine was a precipitate labor. That's why I'm sharp. That's why I'm sharp. You know, I came very fast.
At birth, you already have.
Yeah, so mom is saying, my mother is a teacher.
Were you born on the road?
Not on the road.
I
could be called Oyo. I could be Japheth Oyo or those funny names.
This guy is called
Oyo. Born on the road, yeah. So my mom went to school, then labor began.
She was in school?
Yeah, labor began.
Teacher or she was a student?
She's a teacher.
But she was in school as a student or as a...
Teacher. Yeah, so labor began. She got into one of the minibuses. And those people sympathized. They told the driver, enda to OC direct. Yeah, hata kama wachalewa tumeenda enda to OC. I came out. I was eager to change the world.
And have you so far? So this is Bondo.
Bondo, yes.
We always mocked you that you're from Nango.
Nango.
Is Nango a real place in the first place?
Nango is a real place. It's a growing place. Nango.
Let's call it Nango.
You've never been to Nango?
Yeah.
Most of my friends have been to Nango. You've never been to Nango?
I've never been to your place.
Where have you been to then?
I think you're the only person from Nango I've ever heard of. So Nango is in Bondo?
Yeah, it's in Bondo constituency.
And you were born there and you grew up in Bondo?
Nango. Yes, I grew up in Nango.
Ukakuwa number 1 maisha yako yote? To 3?
That is primary. Yeah, primary I was used to that.
Son of 3 mothers.
Son of 3 mothers.
You were in the first...
The third.
The third wife.
Third wife.
The most loved.
I don't know that.
Are you polygamous yourself?
Myself? No. I'm not.
Why not? Like father, like son?
Just one. One is enough. Yeah.
Okay. All right. So you came all the way from Nango. You went to a public primary. So your parents were teachers?
Yes, both were teachers.
No wonder you wanted to become a chemistry teacher. I see the connection. I see the influence. So you came from there, east your primary, you went to Maranda.
Maranda.
Lakini huko mlikuwa mnaiba mtihani.
I don't know about that. But me, I've never cheated an exam in my life. Why are you laughing, bro?
Even in med school?
No, I don't. I'm a man of integrity. I'm a Burkina Faso. Incorruptible man. I don't believe in stealing exams.
As you should.
Festus, you can lie to yourself.
No one should steal exams.
Yeah, but people have stolen from me, of course. People have looked into my paper day exams. I can't. See wale wa kufunika karatasi. I don't refuse that. Yeah, if someone wants to look into my paper, I'll not. If he manages, well and good.
So you went from, there's a friend of mine called Mugira Silvan, who's a doctor.
Okay.
We were with him in high school.
You were in Nyangori?
We were in the same class.
Where is Nyangori?
Nyangori is a long Kisumu Kakamega. Shule bab kubwa.
Shule kubwa?
Aye.
Never heard of it.
Imeshinda tu Maranda kidogo. So we both got good A's, and we both were called to med school. And he was called to the University of Nairobi. And I had at that time it was being looked at as a curse. Umeitwa Maseno Village University. And he was he's always been sort of a bully. So he made fun of that for 6 years.
Oh.
Yeah, that wako na maprofesa, Maseno mnafunzwa na nani, maprofesa wote wako Nairobi. So for you were in both. And you're saying Maseno hoye.
Okay, well and good. I'll not say that the lecturers there are not good. They are very good lecturers.
Well, they are profs
University of Nairobi.
Several of them.
Very good lecturers.
Yeah. The best.
I agree. Even Maseno has the best. Because they learned in the same schools, those lecturers. They were classmates. Yeah.
His argument was numbers.
Now numbers is the problem. Numbers is the problem. You see, UN, even if you have a number of lecturers and you are that number, you can. In Maseno, we knew our lecturers by name, and they knew us by name.
Which makes a very big difference.
Makes a big difference. Because if I know that Dr. Guer knows me, Dr. Moto knows me by name.
If I don't go to the round.
If I don't go to the round, he will know. Dr. Okewa is... I was Okewa as a student. Okewa has not come to the round today.
Yeah.
He will know. And they knew our capabilities. You could go to an exam, an OSCE, and the lecturer knows your capability. So it was like a discussion, actually.
Yeah.
Even our exams were like discussions.
Yeah, true.
Yeah. So that made the biggest difference. And I think one of the things that has happened to me that I, as a doctor, that have changed my life as a doctor. One, coming to Maseno University, and two, going to Vihiga County Referral Hospital. Vihiga County Referral Hospital. That is the place that made me a doctor.
As an intern.
Initially, I went somewhere else in Eastern Kenya as an intern, where I was posted, and changed to Vihiga.
Now, you like changing. Why
Yes.
did you change?
I told you, I'm assertive.
Yeah.
I'm assertive.
So, what was wrong with the place you went to?
The
this
place?
time?
They wanted to make me a worker there, not an intern. They wanted me to fill the human resource gap that was there. Because you are one intern and you are working in maternity and IMED.
They wanted you to rotate in 2 departments at
In
the
2
same
departments and do calls in 2 departments.
time.
Until the other time, I got PTSD with my ringtone.
Yeah,
Yeah.
I know. I remember.
Even
that.
you.
I got it. I mean, I remember when I finished internship, I had to change my ringtone.
I did too, but you like copying me.
I finished internship before you, so who copied who? Yeah, because I remember that internship ringtone. Oh my god! Because me, I would hear it when it's not ringing. You know, you're just sleeping and unasikia simu inalia. Haili.
Oh, but
Yeah.
that is the hallucination.
Yeah, it's like
You
a
need to be checked.
hallucination.
Were you checked?
I checked myself.
Well, I have a friend of mine who really praises you.
Which one?
You saw the wife. I'll not mention the name. You saw the wife in one of the hospitals in Nairobi, and he said he did a good job. I'm happy. When he mentioned Dr. Nyadimu, I was happy.
I went to Maseno then.
And Nya? He said Nya?
Enyango. Shule bab kubwa. Yeah. So
Yeah.
so Maseno did a good job.
Yeah.
in
It made me assertive. So when I realized that, no, there's nothing I'm learning here,
Yeah.
I had to change.
Mm.
I had to change by all means. Yeah, I know as a leader, when you decide to do something, do it
With all your heart.
with all your heart. Yeah, do it, follow it, and do it. So I changed to Vihiga. When I came to Vihiga, the place was so different. Yeah, consultants always there to help you out. Vihiga changed me, bana. Vihiga made me a doctor. Vihiga made me a doctor. Otherwise, ningekaa ile place ingine, it's not mention the name, I could have been a quack right now. Yeah, I would have been a quack. I would have struggled. I remember struggling to do a CS in that place. Because even the MOs in that place, the way they were doing CSS, yeah. Those guys were like looking for that baby. And at a photo kwa abdomen. Then everything is... But when I came to Vihiga, the MOs made it so simple. So simple. So simple. So VCRH is a nice place.
Kudos. Wow.
Kudos.
Wamepewa sifa kocho.
VCRH.
I hope they are maintaining that.
Yeah, I hope so.
I hope they are maintaining it. And Maseno, I hope pia ina maintain you.
I hope they're doing that. Maseno was good.
Yeah.
Maseno made us.
It did. And apart from even the academic part, I think the social part of Maseno was amazing.
The social part.
You mentioned politics.
Yeah.
Mentioned all that. And you were big in politics. You ran for president for the university?
I ran for presidency and they stole my votes.
You lost, Bwana.
They stole my votes.
You lost, Bwana. But the one thing I realized when I came to Maseno was about tribalism. Where I'd come from, I didn't know people were that tribal. But then I came to Maseno and I found, hey, we have it was called Rasamu and Muswepa. Yeah, it was amazing. I mean, it was amazing in terms of building leaders and all that. But there was a lot of tribalism. So you ran under Rasamu for president. You ran, right?
I ran.
You ran.
But remember, I began my campaigns 1 week. You remember that? When somebody didn't have a B.
It was a B.
Someone didn't have a B and therefore was stopped from running. So I was proposed by my people to run because they looked around and they saw something in me.
Wait, who did you lose to?
Yes?
Who did you lose to?
I forgotten his name, but I think he's Boniface.
Oh, you ran
He's a
against,
good friend.
Oh, you ran again.
Oduri and Palo.
I remember that.
So,
It was
I was with Palo.
the three doctors.
The three doctors.
The three doctors.
Yeah, so you
election.
saw Palo. Actually,
So
split my
you can
votes.
split Kura.
We didn't split. He split my votes.
You're not the one who split his.
Not really.
HP for P.
HP for
What was your slogan?
My slogan.
What was your slogan?
Siome na somu.
Siome na somu.
Hapa kazi tu. Siome na somu.
Yeah.
And it was a big crowd. There were people behind me. But then the admin wanted a weaker candidate. So, as always.
Boni hazikusikia.
Boni, he's a good friend. He
So,
calls me about. I call him about. So,
yeah.
admin wanted a weaker candidate. So, they had to, to stop him by all means.
You are the stronger candidate.
Of course, I was the stronger candidate. And you see, a point reached where they were telling me, why did you come to school for academics? So if this academics ends, that means even this politics will end. So when high threats begin.
So do you think the politics of campus shaped you into a leader by any means?
It shaped me because at least it made me able to approach people. Yeah, I can approach people. I know you have the same, because if you're able to approach me to come here, then you have good skills. So Maseno made me able to approach people. Initially, I was very shy.
You are?
In first year, I was very shy. Yeah, in first year, I was a very shy boy.
We remember you were having had an exposure with anatomy before.
Yeah.
You were apparently very smart. Tuko nakuita prof.
Yeah, I was teaching you guys.
We were calling you prof.
But then when I went into politics, it made me be outgoing. And it taught me that in life you can't live in a cocoon. That's why I was telling you, politics is part of us.
Yeah.
And if you want to succeed in life, be in politics. Get involved in politics.
Speaking of politics now that was politics for campus. You were president of Musomsa at some point.
Yeah, I was
the medical school. You ran for,
and I defeated a 6th year and a 5th year. Remember that?
I remember.
No, it was a 5th year and a 4th year. We were in 3rd year by then.
Who are these? You
Luke Edward.
Oh, you ran against Luke.
Willie Moraga. And I trounced all of them. And I was in 3rd year by then.
Yeah. We voted for you in numbers.
You voted for me?
Aye, but of course.
En masse. You voted for me en masse.
En masse. Yeah, like adhesions. So, you make it. So, you look at Jones. So anyway, so you, now speaking of politics, this is the point I wanted to come to. I see you're shaping yourself up into, the picture of a Kenyan politician. I mean, the kitambi, the shirts. Yeah. Do you have any future political aspirations? Because doctors have been actually wamekemewa for not involving themselves adequately in the running of the nation. That is why you find it an election is over and watu hakuna mtu amerun na hakuna daktari mwenye ako in the vicinity well enough in the winning side to be selected to maybe a position of CS.
Yeah.
Or if they are maybe in the wrong the politics thing. Yeah. Sure. So it just means there are not enough medics or doctors in that space. So do you think you can be, tunaweza kupeleka huko uanze to represent? Because imagine Nakumicha was a CS of health.
Yeah. That was the anticlimax of the Kenyan health sector. That was an anticlimax.
The lowest.
Yeah?
The lowest. It's called a new low.
Yeah, the new low. Climax, the climax. That was an anticlimax. Yeah, of course, I have political aspirations. But you've read the 48 Laws of Power?
Oh, a lot.
You've read it?
Marakada.
Don't reveal your next moves. Yeah, so for now I'll say I have political aspirations. Yeah. Very big ones.
Governor was here.
And for some reason God loves me.
Yeah.
I get what I want. You've never noticed that?
Sasa mimi nitajua aje.
Yeah. So they are, I can't say they're not there, they are, but it's too early to reveal.
All the best.
Thank you.
All the best. Ingia huko maze. We need people with a mindset towards health in that sector. So that
True.
some of these things like we're seeing, like SHIF and SHA. Has SHA paid you your hospital?
I'll not say no. SHA is actually running my facility. I'm running it by money from SHA.
So you're getting.
So for me, SHA is paying me.
Mm.
So I'll not say it's not paid. The time it will stop paying me, I'll make enough noise. But for now, I'll
So
give
is
them a
it
thumbs up.
that it's paying? Public hospitals are not paying because privates are backing out. Most privates are backed
But Festo, you see, sometimes we need to smell the coffee.
And I've even seen governors saying that SHA is not remitted.
Festo, sometimes we need to speak the truth. Private hospitals defrauded NHIF so much. So much. Once I private high school, you can try high school.
Yeah, high schoolers. Yeah, there was
Those guys siphoned money from NHIF. Private facilities. There's a place I worked in Nairobi, Utawala, where they could go to a village and pick for knee replacements.
Replacements, as in?
Knee replacement.
Yeah.
They wapata pesa ya NHIF.
What do you mean pick people for knee replacement?
They just go to a church, convince people that, you
need a knee replacement.
You have a facility, watu wana arthritis, wanasumbua nini magoti, kujeni. Then they will come to that facility, and then there was someone who was there now to convince them
that they need knee replacement.
You need it. So for me, when they reached me, I was now the MO there, I will tell them the truth. We need to do an X-ray and we need to check this and involve an orthopedic surgeon.
Wait, kwani who was convincing them? There's no X-ray, there's no orthopedic surgeon.
There was an X-ray, yes, but someone was convincing them who is not even an MO.
Yeah. And were the knee replacements being done?
Some were being done, some were not being done.
But the claims will be sent.
Yeah, the claims will be sent.
That it has been done.
That has been done. So NHIF was defrauded by private facilities. SHA could be paying, but not as they want it. You get it? Yeah, so, but again, I don't know what is happening with SHA in private, but for public, I know we do claims. Like in my facility, we do claims. And we've gotten some
so they've been paid back.
Yeah, they're paying us. Yeah. For us, they're paying us. But private facilities, number one, they need to make things straight with SHA. There are facilities that could even have patients that are under there in the ward.
Yeah.
You know that?
I know.
Yeah.
But it's the man-eat-man society that Kenya has always been.
It can be changed. It begins with me and you.
But you should ask yourself, this will not happen with another private insurance. Yeah. It will not happen because of the security measures they've put there.
Private insurances?
I don't know if it happens. I've never had. Sijawahi sikia ati a certain insurer, private insurance, money is, or there are claims that are not there, things like that.
Yeah, it's hard.
It's hard. Because of the measures they've put there.
Yes.
I mean, was the solution really dissolving NHIF, or was the solution solving the issues?
No, these of SHA, those ones.
Just a name.
That's just a name.
Because they can still defraud with SHA.
Yeah, they can't.
Nothing has changed. The people are the same. The hospitals are the same.
But now with SHA, you see, most of these facilities, these private facilities, are owned by politicians.
Yeah.
The ones who own them, they have that financial capability.
Yeah. After stealing the money.
Yes.
Yeah.
So what they wanted, SHA, let me tell you why SHA was formed. To make a few steal. You get it?
Or so many people were stealing.
Yeah.
So
everyone was stealing.
Hey, boy. Mutatufikia bwana.
Every Tom, Festo, and Harry. I'll not say the other name. Tom, Festo, and Harry was stealing. So, they wanted a few to steal. Yeah. That's why SHA was formed. No, they could not just change NHIF and say now.
So you are saying it is paying public hospitals.
My facility. I don't know about. Sorry.
We don't know about
it. It is paying my facility. I don't know about other facilities.
But I saw the governor of Trans Nzoia the other day saying it's not been paid. So the entire county. Wametibu wagonjwa, hakuna pesa, so they cannot replace drugs. They cannot replace.
And he's a governor.
He's a whole governor.
Has he Has he provided solutions to the same? Or
Actually, I was thinking of this. There are counties, several counties actually, from what I hear, that have what is it called? They have procured private insurances for their workers,
for the workers?
county staff. Yeah, is Siaya one of them?
I don't know.
Yeah, but there are. I'm sure Machakos has, Nairobi. I've heard something of
You
the
mentioned
sort.
Siaya, but the health is working in Siaya.
It is.
It is. It is. Health is working in Siaya County.
Is it as good as Murang'a?
As Murang'a. I have not been to Murang'a. But
Murang'a
I'll tell
is
you,
top-notch.
the current governor, that's His Excellency James Agri Orengo, he's doing something good in Siaya
Political
County.
points.
Not political points. You know, it's good to say the truth. Okewa says that as it is. That lawyer has done something in the health sector.
Senior council.
That's senior council. Oh, senior council. Health is working in Siaya from the grassroots. He's even paying the CHWs. They're called?
CHV. Now,
CHVs.
Yeah, now they're CHWs anyway.
Yes, and they are going into the villages, bringing patients to the hospital, the referrals.
Primary health.
It is working. I can't say it's 100%, but there is no, it's
I
about
was,
direction.
I was with the Dr. Makata. Makata works in Murang'a.
Mashata.
Makata.
Is a Kikuyu name, so you don't say Makata, you say Mashata.
Mashada. Sawa. I was with
Mashada.
Dr. Mashada, and he works in Murang'a County in the ICU.
Okay.
And he mentioned how well Murang'a County health system is, and he said even if you got a severe head injury along the highway, you're a John Doe, and you found yourself in Murang'a, you will be attended to until you recover without anybody knowing who you are, without you paying a single cent. Can you authoritatively, with your chest, can you say it with your chest, that Siaya is the same?
You've mentioned about ICU and all that. We have an HDU.
In that, this is the county hospital, or
Yes, the county hospital.
There's no
You know,
ICU.
an ICU must have an
They
anesthesiologist
must.
and a critical care physician. Murang'a has that.
It does, apparently. I've not been there, but according to...
Though we have one in training, we have an anesthesiologist in training anyway. But I would say the direction that Siaya is taking is the right one in terms of health. Is the right direction. We may have loopholes here and there, but compared to other counties I hear of.
Let me ask, guys, as we try to wind up this amazing conversation that we're having, that if we do not decide to wind up, we might never finish. Donald J. Trump stopped USAID, and we are speaking of Siaya. I know, as a matter of fact, we did some as students. We went to Siaya for some electives and stuff.
You are in Tingwangi?
No, I was there. We were there for nursing skills, and I think community health as well.
Yes.
Siaya has a very high HIV burden, right? Is it true?
Yes.
What measures has your government, or you as the management, county health management system, what measures have you guys put in place as a contingency now that ARVs are not going to be there in the next few months?
Who has said that they're not be there in the next 3 months?
Well, they're the ones we've been getting for free.
Are you speculating?
I'm not speculating. The USAID fund has been cut.
Let me ask you this. Is this the first time Trump is being a president?
He did not have these measures the last time.
No.
He did not sign this.
Festo is good to answer questions that are asked.
Of course, the question you're asking is Swali
Is it the
Abalaga.
first time? It's not the first time.
It's not the first time.
When Trump became president in 2017, the same issues brought up their necks. The same issues, yeah? But then what happened? What happened?
Tell me. Nothing.
Status quo was maintained. So even right now, you know I was late for this interview. You know I was late?
No.
I was meeting the CHS and the Fisher Folk team. Ever heard of Fisher Folk?
Yeah, today. I just had it right now.
Yeah, it's a program under CHS that tries to give prep, test the Fisher Folk community. Yeah. So it is still, things are still going on as usual.
They are, but as I think, I don't know who said it from the ministry that we have supply for the next, was it 9 months or 6 months? At that time will lapse.
We will have supplies.
Are we hoping that Trump will forget?
You will not forget.
and
Things will just be fine.
reinstate-
Things will just be, status quo will be maintained.
Daktari, I think you're hiding your head in the sand and waiting for the storm to pass.
You know, when Trump became president in 2017, the same things were said. Oh, ARVs hazitakuwa. Oh, watu wako na HIV.
But he
wanaenda
did not sign the
kuteseka.
executive orders.
This time he signed.
This time he signed them.
Ah.
And jobs have been stopped.
Well, they have been back to work.
Are they?
Yeah. I met them today. I've just
said-
mentioned that. I met them today.
So you are saying tuendelee tu kutegemea hii msaada.
But why msaada anyway?
It is msaada.
Why should we tegemea msaada? and we have
That's
enough
what
money
you're
as a
saying
country?
because I was trying to you were saying CI is on the right track in terms of health. And was CI no, in terms of infectious disease, CI is one of the top up there. So that is where they should be focusing on. Right?
Okay.
Yeah, so but
Of course, there are preventive measures. Now we have the CHAS, the HWs. You see, first of all, is good to prevent something.
Yeah, it is.
Prevention
It
is always better than cure.
It is, but there is already the burden. The
Yeah,
prevalence
there is
is
the
already
burden
there.
already.
We will prevent incidents, but how many lives are going to be lost? The
If
ones that are already there.
the drugs are not there,
And one of the best way of preventing HIV spread is making the viral load zero.
undetectable.
Yes.
You know, it can't be zero.
Okay,
It's undetectable. So I still have a feeling that the
But
drugs will be
things
there.
will be fine.
Things will be fine. But even if they stop the aid, I believe the Ministry of Health can procure ARVs.
Hii Ministry of Health yetu hii.
Yeah,
Hii yenye itaki kulipa interns.
it can procure.
Hii yenye itaki
First of all, there is
kulipa
money. But now the problem is we have not got into politics. We don't have people up there that can influence policy. That's what I was telling you, should be a wholesome doctor. So that you influence policy.
Yeah.
So that you speak about, when something is wrong, we speak about it. So that we can say as doctors, if there are no ARVs, we all go on strike. And we decide that all doctors are going on strike, all clinicians, that we paralyze the health sector until this government procures
Provides.
those essential drugs. And when we decide, we decide. You know why people hate Siome and people love Siome? If I decide, I've decided. I take time to make a decision, but once you make it, you go with it like an eagle coming to pick a snake. Hata kama
Eyes on the prize.
kitu imekuja hapo inapita na hiyo kitu.
Doesn't matter.
So if as doctors, as healthcare providers, we are the ones to influence policy. We are not the ones to dine with the government. Sijui government imepeleka watu wa sijui chama sijui wapi. If we decide that we are going to paralyze healthcare until this is done, and we do it, all of us, with one body, with the union, with the unity, then
Would you take up a position in the union?
in the union, of course I can, but I feel that's trivial. I think
Dr. Japheth Siome, ladies and gentlemen, amesema KMPDU ni trivial.
yeah, that's trivial because I feel I can fight from somewhere else.
Somewhere.
The union has really been compromised, first of all. A lot. The union has been compromised and defanged and debeaked and declawed. So it's no longer what it was.
So what's the future for Siome in medicine? You asked me if when I'm going back to school. When are you going back to school? Najua 3 years after internship, you're now chronic.
I'm now chronic anymore.
Yeah.
I'm chronic.
3 years after internship,
You said
chronic.
you finished internship before me. So you are
I'm more
acute
chronic.
on chronic.
I am chronic. You are-
I'll go back to school. Don't worry about it.
what do you want to do?
Rheumatology.
Oh yeah, we've always by the how can
Rheumatology.
how can I forget this? We've always been a champion of SLE.
Of SLE.
Can you tell us about that as we wind up?
As we wind
in
up.
few words.
You know what lupus is? It should be pronounced as
Doctor.
lupus. Lupus, not lupus.
In Latin.
Because lupus is Latin and Latin words are pronounced the way they are. So it's lupus.
It's our Latinologist.
The lupus is an example is you as Festo. You have Bosco. You know Bosco?
My Ika dog.
You have your dog. So this dog should protect you from thieves, right? But a situation comes whereby the dog starts biting you. Understand? So what happens? The dog is biting you. So number one, it is harming you. And it's biting all over.
But
Number
you still
two-
need the dog.
Huh?
But you still need the
I think
dog.
this story is mine. Let me finish it. So then, dog is biting you. Then a thief comes. What happens? The thief will steal as the dog is biting. So it's double damage. So in SLE, the immune system that should protect you is actually fighting you. It is destroying your body, your organs. And as it does that, other illnesses can now also. So it's an autoimmune illness that is very common. Not very common, but common. Yeah, many people out there have passed with undiagnosed SLE. And I'm a lupus champion, and I'm glad I meet patients. We have a group, a support group, and that's what I'm passionate about autoimmune diseases.
Why?
Yes?
Why? What informs
Why?
your passion?
You see, Festo, when you have passion for something and you have something informing it, no, that's not passion.
It's what? It's desire.
Passion is intrinsic.
It's intrinsic.
Intrinsic.
It's like love.
It's like love. True love. You see, when you say, I love you because you're beautiful.
Yeah. It's
One
not
day
love.
she's not beautiful. If she say, I love you because you know how to do this, one day, then another unconditional. So passion is unconditional.
It is.
Yeah, so rheumatology is inborn in me. It's inborn.
Amazing. We have very few rheumatologists in Kenya.
Very few.
Very few. I
Yes.
think I know 3, 2,
Okay.
only. So all the best when you become. But remember, when you go and become rheumatologist, remember rheumatology is very expensive. Treatment of these SLE things is very expensive. So uende ukuja na donors ama ukue governor pia fanye SLE treatment. Therefore, the drugs are expensive, tests are expensive. Most of them are not even done in most of our labs. So yeah.
And most of those patients die because of lack of drugs.
Yeah.
I'm in that group and it's a major killer. But like every month in that group. Yeah. Like almost every month we're burying someone. You know the reason?
Poverty.
They can't see a doctor.
Yeah.
They can't afford drugs. They can't afford this and that. But Festus, why should it be expensive to see me or to see you? Ask yourself that. Why should it be expensive to see you by a fellow human being? Don't answer that. Why should it be expensive? That someone has to die because they can't afford
Seeing me.
to see you or to see me.
Why?
Why? Why should it be very expensive to get drugs for a group of people who really need those drugs? Why should healthcare? You know, you are one disease away from poverty.
Yeah.
Are you aware of that?
I know.
All of us are one disease away from poverty.
Lakini mi nika billionaire fulani.
So I think
maybe 4 diseases.
4
4
to
away from
the
poverty.
way you're small.
Well, I'm small like this.
So I think healthcare, that's how I want to do rheumatology anyway. And I think even in oncology, I see patients die of cancer because of poverty.
Poverty, yeah.
Because of poverty. Someone has cancer, but then they can't afford chemo. Yeah, there's a patient I was seeing at home, and this patient went to a facility and then was diagnosed with breast cancer
Yeah.
and was told to come back to the clinic. First of those people who book patients for clinics, they should be trained. Because some breast cancer, stage 1, you can't give them a 6 months TCA. Then they come back.
Yeah.
developed.
And I know because this is a problem mainly in public hospitals. Because I've worked in a private hospital, and one of my most fulfilling moments is when a patient came from home, not referred nowhere, ametoka home. Daktari, I have a breast lump.
Okay.
Then you know, mammogram done, imetuambia it's by RAD5, it's a suspect. Then interventional radiologist called there, and
Oh.
then a core biopsy done the very same day. Within a week, we have results. The next week, the patient is on chemo. Come to the rural public facilities, and oh my God.
Yeah. So it can happen. It can be
It
done.
can happen. It can be done.
That was in Kenya.
That was in Kenya.
You are a travel man. You travel country. So that was in Kenya.
That is in Kenya.
So it means if it can be done in some part of Kenya,
it can be done in all over the country.
So we can do these things. We can. Okay.
Amazing. Dr. Siome, parting shot. Last word in 3-4 words.
In 4 words. It can be done.
Daktari, a quick one. It's been amazing having Dr. Siome. Until next time, adios. Kama kawaida, like, comment, share. See you next time.